Hello, everyone, and welcome to RAK Hospital Podcast Series. My name is Victoria Shedwak, and I'm more than happy to talk about a very intriguing topic, which is minimally invasive surgery, which is a modern way for tiny cuts and faster healings. Today, I am very happy to have special guests, general surgeons, coming straight from RAK Hospital, Dr. Shalabh Mohan. How
Hello.
are you today? And Dr. Niranjan Ravichandran. How are you?
I'm fine, thanks. How are you?
Very well, thank you. So first of all, let's talk about the basics, right? Let's talk about the basics. What is it, and what is the difference between the standard traditional open surgery, Dr. Shalabh? What do you think?
See, minimal invasive surgery, it's not so recent. It's been around since 1988. And basically, it's the same surgery with a different approach. Instead of large cuts, what we do is we operate through tiny incisions. We insert a camera and specialized instruments to the same surgery.
All right.
And it has many advantages. As the name suggests, minimally invasive. Basically, we are producing minimum injury to the body tissues
Yes.
and getting the same results, right? So imagine making a big cut in the abdominal cavity to do a routine surgery.
Absolutely.
It causes a lot of tissue injury. There's bleeding, there's pain in the post-operative phase. There's going to be a longer recovery time because the more the injury, the more the recovery time, right?
Yeah, absolutely.
And when you compare it to minimal access surgery, it's tiny little cuts. With the camera inserted inside, you get a magnified view, you get a clearer vision, there's finer dissection, there's less bleeding. And the overall result for the patient is so much more better.
Okay, so we include already technology, which is a tiny camera, yeah?
Yes.
Okay, that sounds very interesting. According to the recent practice, which common surgeries are currently being done using this minimally invasive technique?
Many major surgeries are probably done better in a minimally invasive way. So it's not the degree of surgery which determines whether we're doing it in a minimal access approach. Almost all surgeries that we do are amenable to minimal access, to minimally
okay.
invasive surgery.
Okay, so it doesn't matter really the kind of sickness it is, the kind of
No.
case, no. Oh, okay, that's very interesting. Okay, I understand. All right, so maybe now I'll move on to Dr. Niranjan. So from your point of view, how does a patient benefit from this surgery? Yeah.
So when you see with minimal access surgery, we have less cuts.
Yes.
Less cuts means less pain,
Yes, please.
a shorter recovery time.
So now, because we need to assume that our listeners, whether you are into medical field or you are just interested, you can listen to us, because right now let's assume that we know nothing. I know nothing in this field completely. So let's say I am a patient right now. How do I prepare for it? What should I do, doctor?
Like any patient, you'll come to the doctor,
Yeah.
right? Once we understand the disease and what the treatment is, suppose a surgery is involved, right? The doctor will explain to you the disease and what should be the treatment plan.
Yeah.
If it's surgery, what are your options? What are the risks and benefits?
Yeah.
If you want to discuss whether it's what happens if you don't get the surgery done versus getting it done, right? And for a patient to prepare, basically, I think the patient should be well informed, but through the doctor, preferably not through Google.
Oh, definitely, yes. We don't want
Right?
to
I mean,
read anything on Google.
Google is great.
Google
You
is
should go
great.
there, get all your information, but please make sure that's verified by a doctor.
Definitely. Oh,
That's-
if you Google,
that-
oh my God,
Um,
you will figure out that you have everything,
Yes.
whatever you can imagine. Oh, yes, definitely. We don't want that.
right? So that's part of the preparation, and the doctor will tell you what are the risks and the benefits, and nothing more. Once you've done your investigations, you have your consultations with the concerned specialist, whether it's a surgeon, the anesthetist, maybe a cardiologist or a physician. After that, there's a date for surgery, and you have to reach the hospital. Most times we admit the patient on the day of surgery itself, right?
So now, from my point of view as a patient, how should I prepare for it now in terms of the diet, if there is any specific diet for it, since it's a minimal invasive surgery? So
Well, since it's minimally invasive, that means there's minimal preparation required.
That's amazing. Oh, that's great
Right.
news for everybody here. Okay.
So most routine surgeries, the standard advice to the patient, it's a normal day for you, one day before surgery,
Yes.
right?
Yeah.
Till about, say, dinner time or maybe 6 to 8 hours before your planned surgery. After that, nothing to eat, nothing to drink, not even water.
Not
right?
even water.
Oh, not even water. That's important.
For 6-8 hours, you mean?
That's the standard time.
Okay.
So you need a patient to be empty stomach for any surgery, whether it's minimal access
yes,
or
yes.
open, right?
Yeah.
And that's a concern for anesthesia if you're not empty stomach.
Okay.
So that's the only preparation required. Patients with medical conditions, they will be counseled before the surgery by the anesthetist as what medicines to take, what medicines to skip,
Yes.
and that's about it.
All right. And how about Dr. Niranjan? Now, what about the mental approach? How should we prepare mentally for it? Because, of course, this is a very important aspect, not only physically, but you need to look at it from the mental side.
I remember when he said that you should not Google.
Yes.
7 years ago, I Googled for myself for a health condition. And you know what it said?
Everything.
No, it said that I'm going to die in 6 months.
Oh, yes.
It's now 7 years now.
That's.
Can you believe?
Yeah.
So the first thing I would say is visit a doctor. Okay. If you have any doubts, don't go to Google. Go
Yeah.
to another doctor. Okay.
Okay.
In the same institution or some other hospital, go to another doctor, consult, talk about the surgery. I feel the more you talk about surgery, surgical steps, its pros, cons, complications, risks,
Definitely.
you will have a better understanding of the surgery and you will feel more confident. Trust me.
Yeah.
My patients have told me this.
All right. We spoke about preparations. How about now the procedure itself?
Okay.
So let's start with the first things first. In terms of the the first step, will I be awake?
Of course not. It's a surgery,
Okay.
and minimal access surgery invariably requires general anesthesia. So, as a patient, you'll be taken to the preparation area or the OR room. The anesthetist will put in an IV line. He'll give you some medicine. You go to sleep, and that's it. When you wake up, it's all over. It's all done, and the surgery is over.
Nice and easy.
For the patient, yes.
For the patient, definitely yes. For you, it's a huge task.
Yeah.
But of course, we have specialists here, so we as patients we should feel very safe. Okay, wonderful. So my next question was actually about anesthesia, so you already answered 2 questions. Okay, thank you so much. Now, about the technical aspects, how about we'll talk about the cameras, because that's a really interesting point that you brought. What is the equipment that you use usually?
So basically, cameras have evolved from time to time. Nowadays, we use 4K cameras with excellent vision, and there are some centers which use 3D cameras also, where you will have you'll know the depth, penetration, and everything. So we have the highest standard cameras as of now, and all the other instruments. With instruments, previously we didn't have an energy sealer before. Now we have all types of instruments where you don't even see one drop of blood spilling.
Wow, that sounds really fascinating. It gives me the feeling it's like in the virtual reality.
Yeah.
It's not the actual surgery, but the virtual reality, if that makes sense. Wow, that's really interesting. Okay, so we spoke already about the full procedure, but from my side, I'm pretty much curious now from your experience. What was the longest surgery you've ever had in your career? Dr.
Well, the longest for me was a minimal access surgery. It was a esophageal cancer, which lasted almost 11 hours on that particular day.
Oh my God. Okay, all right. So because before the rolling the podcast, we actually had this opportunity to talk a little bit more about this topic. So I will ask a little bit more, if you don't mind, Doctor. So you take some breaks. Do you take some breaks during the surgery? How does it look like? Because of course, 11 hours. How can any human being last that long?
You have to. I mean, if you don't take breaks, imagine you're doing fine surgery and fine dissection, right? So you're going to get fatigued. And if you're fatigued, you lose concentration, you lose your motor skills. So it is important to take a break. Even players on the field, they'll take a break, right?
Yes.
So that's what we do. Every few hours, we'll announce a break. The patient is fine. He's on the table. He's sleeping. He's comfortable, not feeling anything at all. We'll take a break, freshen up, come back after 15 minutes. And that way, the surgery becomes more efficient.
Definitely, yeah. How
And
about
this will be in turns. If there are 2-3 surgeons, probably 2 surgeons will be taking a break at the time, and then another surgeon will be taking care of the patient, and then the third surgeon will go for a break. It happens like that.
So what was your longest
I
surgery
don't
you've
do
ever had?
malignancies. Usually malignancies take time. I usually do daycare surgeries and other short surgeries. I don't do malignancies. So usually malignancies are the ones which take time. Yeah.
How long? Like
Malignancies, as you said, it could be 6 hours, 7 hours. People's might take 7 hours, 8 hours. So it depends on surgery.
You mentioned also before the we started on the podcast, because this is for our listeners a little bit, a tip from behind the scenes how it looked like. So the transplant, you also mentioned that one.
Yeah.
So how does it look like? Because we spoke about the kidney transplant. So we have
so
two patients
with transplants. Okay, so there are two types. One is from the donor, the other one is for the recipient. Usually donor surgeries are done minimal access, and recipient surgeries are done open, because it's very important for the recipient.
All right.
So the donor has two kidneys, but the recipient should
Stay
will be
with
having
one.
one kidney, and it should be perfect.
Yes.
So it's usually open. Donor nephrectomies, I don't do it, but it usually takes around 2 hours, 2.5 hours max. Yeah.
Okay. So this is doable, right? You can
Oh,
do
yeah,
it in
yeah.
one go. No need
yeah.
for the breaks that
No,
much.
no, no.
Okay.
I don't think so.
That sounds interesting. Okay. So we are done with the surgery. Let's assume, nice, everything is great. The surgery went perfectly fine. Now, are there any common side effects that might occur? Post-surgery symptoms,
Yes. So
to watch for, like hypothetically.
see, I'll divide it into two parts. There's basically the side effects or the discomfort the patient feels, and the potential complications, right?
Yes.
Right. So, as far as the discomfort or the side effects the patient feels immediately after surgery, it's common for people, and it depends upon the medical condition, the duration of anesthesia, and the type of surgery. So, it's common for people when they're waking up to feel a little disoriented, drowsy. Maybe they feel, for some time, they might feel a little breathless, or they might cough, they might have nausea. But all these things are very temporary, and there's the anesthetist and the doctors are on standby to make sure the patient is informed about everything. The surgery is over, it's fine. You can breathe normally, you can breathe comfortably. If the patient is having pain, we give the patient painkillers. So that's in the immediate phase, as soon as the patient wakes up from his anesthesia.
So this is not really that serious. It's a normal
Yes.
standard, I would say, process.
It's standard to basically any surgery and any anesthesia. In fact, with minimal access surgery, here are the advantages. More than just the cuts and the dissection or the tissue injury. With minimal access surgery, since the overall pain perception during surgery is less, the anesthetist has to give less narcotics, which means in the post-op recovery, the advantages are the patient is up and about faster, there's less nausea, the patient can start eating much earlier.
Earlier, you mean? Approximately?
The standard surgery, patients are told to get up, walk, go to the bathroom, and they can start eating 4 hours after the surgery.
Okay. So that's doable. We can survive 4 hours.
Yes,
Should
you
be
can.
fine. How about water?
Yeah.
How about water? Is it okay earlier? Or?
No, everything starts after 4 hours.
Okay. So that's a good point. Okay. So we need to keep in mind that. Okay. Okay, fine. So, Dr. Niranjan, now the question from my side about exercise, about coming back to work. How long do we need as a patient? How long do we need to go back to work, let's say?
It depends on many factors. Okay. First of all, it depends on the surgery that we do, and depends on the work that the patients do. Okay. If it's a day case surgery, what usually happens is, as Dr. Shalabh said, we give them food 4 hours after surgery. We make them walk, and they can go home same day.
Wow.
Yeah? And then they can start doing their work 3 to 5 days time if it's a desk job. If it's a manual laborer, I usually advise them to take some more rest, maybe 7 days or 10 days. Yeah.
Yeah.
And in terms of exercises, I would probably tell them to do light exercises after 2 weeks. When it comes to heavy exercises, I would tell them not to do for 4 or 6 weeks, especially gym, weightlifting, to avoid hernias.
Oh, yeah. This one we'd have to wait a bit more. Of course, absolutely. Okay, we spoke about the side effects. How about the risks? and any potential complications, because we have to know the situation from all of the perspective, right? As potential patients, it's better to be well aware of what might happen.
See, in surgery, just like everything else in life, what we do is whenever we perform any action is we weigh the potential benefits to the risks, right? Surgery is a serious enterprise. There are risks to any surgery, right? The only thing that is important for a patient to understand is what are the risks of getting a surgery done versus the risks of not getting it done. If the risks of not getting it done are higher, obviously it makes sense to go for the surgery.
Of course, absolutely.
Right? It is our job as doctors to explain the risks and also explain to the patient two most important factors. What are we doing to minimize that risk? And in case a problem happens, can we handle it?
Yeah.
Right? So, in fact, those are the questions a patient should be asking. I get patients who tell me that what are the percentage chances of me developing a complication? Now, for one individual, that's a very difficult question. Mm-hmm. Percentages work in large populations when we're doing a statistical study. For one patient, whatever happens, good or bad, is 100%. Mm-hmm. Right? So, but I try to put things in perspective. I tell them, see, you came on the 311 down to the hospital. That is riskier than getting the surgery done. And that's a fact. That's a statistical fact.
Yeah.
Surgery these days, it is not zero risk, but it is definitely low risk for most patients.
All right. Wow.
Especially when it comes to minimal access surgery.
Yes.
The risks are lower than open surgeries. And there are statistics for each and every surgery, for each and every complication. So there are worldwide statistics. So we need to explain them. What is the stats? What are the risk factors? What are the complications? And what is the incidence of those complications?
So from your perspective, there might be a situation that occurs to be quite more complicated. So instead of doing the minimally invasive surgery, you might, during the surgery, right, you might change it to the traditional open surgery. Mm-hmm. Yeah.
Yeah.
Okay. So what are the examples?
So usually when there is uncontrolled bleeding, where we don't even see where the bleeder is, that is when we commonly convert to open surgery. The other common condition is when if the patient has had multiple previous surgeries, then the bowel and the abdominal contents become sticky. When it sticks to each other, when it sticks to the wall, it's very difficult to perform minimal access surgeries. In that case, we might do open surgeries. So these are the two common conditions where we convert laparoscopic surgeries to open surgeries.
All right. Thank you so much, doctors, for your time. That was such a pleasure to be here with you. Okay, so now from my side, I would like to ask you for your advice to our lovely listeners. From your perspective, what a patient should be aware of?
This question reminded me of an 80-year-old gentleman whom I met in the UK. So he came with a notebook in his hand. I've never seen a patient like that. He opened his notebook and he had 15 questions noted down. 1, 2, 3, 4, 5, 6, 10, 15.
Wow.
And he asked me the first question. He noted it down. Second question. So I like those patients, and I always tell my patients. So suppose I see a patient now and I suggest surgery for them. I tell them, you still have time. Okay? You still have insurance approval, and you still have pre-anesthetic clearance. Go home. Think about it. Note down all the questions and come back to me. I can explain to you. If you're still not satisfied or you have some more doubts, I can refer you to my colleague, Dr. Shalabh. You can go to him, talk to him, and get your doubts cleared. Yeah? So this is very important to me, and to the patient. The more they are informed, the better their understanding is, and the clearer they will be.
Yes, the more you are aware, the less you are afraid, because you know what you are facing. Yes, as we have the saying, the fear has the biggest eyes, because you never know what's going to happen to you if you don't know, if you're not aware. Okay, amazing. Especially now, at the RAK Hospital, we have so many really good specialists, so we can ask for advice, from one person, then from another person, and just to see, that's amazing. So thank you so much for being with us today in the studio. Thank you so much, doctor. Thank you so much.
Thank you.
And stay tuned for some more. Thank you so much one more time to RAK Hospital. We have some more episodes coming up. So we'll see you very soon.